Well, turning now to a new health study. If you're a bacon and soda lover, you may want to rethink your diet. The study published in the Journal of American Medical Association earlier this week links 10 foods with deaths from heart disease, strokes, and diabetes. Some of the good foods that we're not eating enough include nuts and fruits. The bad foods overeaten by thousands include processed meats, just like bacon. Cardiologist Dr. Campbell joins me now on set. Dr. Campbell, so it's clear, we know this. Diet hugely affects our health. What else have we gleaned from this study?
You know, it goes back to the wonderful Mediterranean diet where you eat lots of good nuts, fishes, olive oils, and you avoid a lot of the red meats and other high sugar content type things. And I think that's what it really boils down to. And that study is very consistent with what we found.
So where does this study take what we already know about diet a step further?
You know, it really shows us that if we eat the right things and avoid the things that are not good for our heart, that it can make a big difference. The big thing in this study, though, is they linked it to almost 50% of the deaths from heart disease, diabetes, and stroke, which are major killers in the U.S. today.
When you look at those foods, what was the biggest offender?
Salt. Added salt is a huge problem because it raises our blood pressure. It puts increased risk and stress on our heart, and it also damages our blood vessels through stretching them to, high pressure levels. So salt is something that we have got to do a better job eliminating in our diet.
What foods should we be incorporating?
You know, it's always like your mother said, the fruits and the vegetables are very important. Nuts, actually, when you get hungry during a busy day in the newsroom, if you just have a handful of nuts, it can satiate you, and it's also very helpful. It has lots of good things for you.
Matter floor director knows I have a big bag of almonds that I keep below the desk here throughout the day. I wish that they taught diet and nutrition to children in school. I wish my kids could take that class. They don't even do this in medical school, you were saying.
When I was in medical school, we had very little instruction on nutrition, and I think it's so key because as a society, we are obese, and our doctors and, our parents and everyone involved in our lives needs to really push the importance of diet and exercise, and nutrition education is critical to that.
I want to turn now to another study that was published this week. It found that fewer overweight Americans have been trying to lose weight. Why do you think that is?
We've had to find a real balance between, accepting body types of all different sizes and shapes and also being healthy. And I think this study showed that more and more Americans aren't interested in losing weight. But what I would say to this is be the best and healthiest you that you can be, no matter what your body type or body shape is.
Is there a way of gauging why more obese Americans feel they don't really need to lose weight?
I think a lot of it is, I think many of these folks feel, really unempowered and almost hopeless because if you say, I need to lose 75 pounds, that's a terribly big goal. But if you say, I need to get off the couch and walk a mile 3 times a week, or I need to eat better, or just do something, and then break it up into tiny segments, a pound here, a pound there, that's doable.
So for people who know they need to lose weight, what is that baby step they could take in this next week that can make a difference?
You know what? If you're someone who doesn't do anything from a physical activity, get up and walk around the living room, walk to the mailbox. I always tell my patients, just move and feel very good about that. And then the next day or the next week, try to do just a little bit more and feel good about that. Just keep moving is my advice.
And the one thing on diet that they could change?
The one thing on diet is make sure that you stock your house with lots of healthy snacks, fruits and vegetables, things of that sort. Plan your meals in advance and cook them on the weekends so that when you're busy, you're not rushing off to fast foods. You're having a good, well-prepared, nutritious meal at night.
Food planning really makes a difference, doesn't
it? It does. It's a great family activity.
I'm not a bad mom because I bought those Oreos, did I, for the lunchbox?
Everything in moderation. Everything in moderation.
Okay,
even Oreos.
Dr. Campbell, thank you so much for joining us.
Thank you.